Last month, a viewer named Dorothy from Nova Scotia left a comment on my benefits video that I have not stopped thinking about. She wrote, Linda, I am 73 years old. I worked as a school secretary for 29 years. Last Tuesday, I paid $460 out of pocket at my dentist. 2 days later, my neighbor told me she had the same procedure done completely free under a government dental program. I looked it up and I qualify. I have qualified since the program launched. I have been paying out of pocket for every dental visit for a year and a half while a free program sat there unclaimed in my name. Nobody told me. Not Service Canada, not the CRA, nobody. That comment received over 1,300 replies from seniors in British Columbia, Alberta, Manitoba, Saskatchewan, and New Brunswick, all saying the exact same thing. They were paying out of pocket for dental care they should never have paid for. They qualified for a confirmed federal government program that would have covered it entirely. Today, I am going to tell you exactly what this program is, who qualifies, what it covers, what it does not cover, and how it connects to your CPP, your OAS, and your GIS in ways nobody else is explaining clearly. Before I walk you through everything, one critical thing first. The next OAS and GIS payment date is approaching, and Service Canada will not send you a personal letter explaining that a free dental program exists and that you qualify. Subscribe and turn on notifications right now so that every time something this important comes up, you find out here before another dental bill arrives that you should never have paid. Now, let me show you exactly what this program is and why most eligible seniors have never claimed it. This is the Canadian Dental Care Plan, a confirmed federal government program launched under Budget 2023 and administered through Sun Life Financial on behalf of Health Canada. Designed specifically for Canadians who have no access to private dental insurance and whose adjusted family net income falls below specific thresholds confirmed on canada.ca. According to Health Canada's Canadian Dental Care Plan pages on canada.ca, the program is available to Canadian residents who meet the income criteria, have no private dental insurance, and have filed their taxes for the most recent year because the CRA uses your filed return to verify eligibility and generate your enrollment invitation. According to government-published data, millions of Canadians are eligible and a significant portion have never enrolled despite meeting every criterion since the program opened to their age group. Canada has never had a federal dental program of this scale before, which is exactly why so many eligible seniors have never been told to apply. The first thing every Canadian senior needs to understand is the income eligibility thresholds and what they mean for someone receiving CPP OAS and GIS together. According to canada.ca, S Canadian Dental Care Plan eligibility page, the program provides coverage on a sliding scale based on adjusted family net income. Seniors below the lower income threshold receive coverage with absolutely no cost sharing, meaning the program pays the full approved amount for covered procedures with zero payment from the senior at the point of service. Seniors above the lower threshold but below the upper threshold receive coverage with a co-payment where the program covers a percentage and the senior pays the remainder. Seniors above the upper threshold do not qualify at all. These thresholds are confirmed on canada.ca annually and are based on the adjusted family net income figure from your most recently filed tax return, which is the exact same figure the CRA uses to calculate your GIS eligibility and your OAS clawback every July. For most seniors currently receiving GIS alongside CPP and OAS, their adjusted family net income is almost certainly below the lower threshold, meaning they qualify for full coverage with zero copayment and have been qualifying since the program opened to their age group without ever knowing it. The average Canadian senior who qualifies and enrolls can access coverage for preventive care, diagnostic services, and restorative procedures that would otherwise cost hundreds to over $1,000 per year out of pocket. The second element is where most people get completely caught off guard, and it involves the private insurance exclusion rule that disqualifies otherwise eligible seniors based on coverage they may not even be meaningfully using. According to canada.ca S eligibility rules, a senior is not eligible if they have access to private dental insurance regardless of whether that insurance actually covers the procedure needed, regardless of whether the coverage is adequate, and regardless of whether they are actively using it. A senior with a very limited dental rider that pays almost nothing, a senior whose spouse has employer coverage extending to them as a dependent even if never used, or a senior still maintaining a private plan whose premiums now exceed what the plan actually pays, may be completely disqualified based on having technical access to private coverage, even if that coverage is worthless in practice. Who qualifies includes seniors with absolutely no private dental insurance in their own name or through a spouse, and those whose only dental coverage comes from provincial or territorial government programs, which do not constitute private insurance under the plan's rules. This exclusion is the single most common reason otherwise eligible seniors are denied, and most find out only after applying, waiting, and receiving a denial letter citing coverage they never thought would disqualify them from a free government program. Third, and this is the part that connects directly to your CPP and GIS together, is the mandatory tax filing requirement and what it means for seniors who have not been filing because they assumed their government income was handled automatically. According to canada.ca, S enrollment process information, eligibility is verified through your CRA tax file and an enrollment invitation is generated from your most recently filed and processed return. Seniors who have not filed will not receive an invitation even if every other criterion is met. This creates a direct connection between the dental plan and GIS that most coverage never explains. GIS also requires a filed tax return to be renewed annually under the Old Age Security Act, which means a senior not filing is simultaneously missing their dental plan eligibility and risking GIS suspension. Filing a return, even with zero income beyond CPP and OAS, activates both the dental plan enrollment and the GIS renewal through the same CRA file at the same time. Here is the insider knowledge moment that will save eligible seniors the most money immediately after enrolling. Only dentists enrolled in the Canadian Dental Care Plan as participating providers can bill the program directly. A senior who shows their member card at a dental office that is not enrolled will receive zero coverage for that visit because non-enrolled dentists cannot submit claims regardless of the senior's enrollment status. Confirming your dentist's participation before booking any appointment is not optional. It is the step that determines whether your enrollment produces real coverage or the same out-of-pocket bill you paid before enrolling. Additionally, preventive procedures, including examinations, cleanings, and x-rays, are covered at the strongest rates, while more complex restorative procedures may require pre-authorization or be subject to frequency limitations. Seniors who confirm both their dentist's enrollment and the coverage level for planned procedures before every appointment consistently get far more value from their enrollment than those who discover limitations only at the billing stage. Canadians who work with retirement financial planners and benefits advisors have this confirmed as part of their annual benefits review. Most Canadian seniors on CPP and OAS find out about these details only after receiving a larger than expected dental bill. Now you know before that happens. Now here is the connection that most coverage misses completely. The Canadian Dental Care Plan connects directly to your GIS, your OAS, and your CRA filing status through the adjusted family net income figure all three programs share. The income threshold determining your dental coverage level is the same figure Service Canada uses to calculate your GIS every July, and that the CRA uses to determine your OAS clawback. Any change in your reported net income affects your dental coverage level, your GIS calculation, and your OAS situation, all simultaneously from the same tax return. A senior whose CPP increases slightly from the ongoing enhancement may find that increase pushes them from the full coverage bracket into the copayment bracket for the dental plan at the same July point where their GIS drops through the 50-cent reduction formula. Two negative consequences from one income increase through the same mechanism with no personal warning from any government agency. A senior making a one-time RRIF withdrawal may find the income spike simultaneously reduces GIS for the following July, triggers an OAS clawback, and pushes adjusted family net income above the dental plan threshold, making them temporarily ineligible. Three program consequences from one financial decision, all traceable to the same net income line on the same tax return. Dorothy did not know about any of these connections. She knew she had been overpaying for dental care. She did not know the same income figure controlling her GIS was also controlling her dental plan eligibility, and that any future income change would affect both simultaneously. Dorothy applied for the Canadian Dental Care Plan the week after leaving her comment through canada.ca. Her adjusted family net income placed her clearly below the lower threshold, meaning she qualified for full coverage with zero copayment. She received her member card by mail within a few weeks. Before booking her next appointment, she called her dentist to confirm they were enrolled as a participating provider and that her planned procedures were covered at the standard rate without pre-authorization. They confirmed both. She attended her appointment, her dentist billed the plan directly, and Dorothy paid absolutely nothing. She wrote back 2 months later and said that $460 bill was the last dental payment she ever expected to make out of pocket. She also called 3 friends receiving CPP and OAS, and 2 of them qualified and enrolled within the same week. If Dorothy had known receiving GIS alongside CPP and OAS was a strong signal she qualified for full free coverage, she would have applied the day the program opened to her age group. So here are 3 steps you can complete this week. Step 1. Go to canada.ca and find the Canadian Dental Care Plan eligibility page. Compare the confirmed 2026 income thresholds to your adjusted family net income online, $23,600 of your most recent notice of assessment, which you can access through your CRA My Account at canada.ca/en/revenue-agency. If your income is below the upper threshold and you have no private dental insurance, begin the enrollment process immediately. Step 2. Confirm your most recent tax return has been filed and a notice of assessment has been issued because the enrollment invitation cannot be generated without a processed return on file. If you need free help filing, contact the CVITP at 1-800-959-8281, where volunteers help eligible seniors file for free. Step 3. Once you receive your member card, call your dentist before booking and ask specifically whether they are enrolled as a participating provider and whether your planned procedures are covered at the standard rate or require pre-authorization. Share this video with every person you know over 60 receiving CPP or OAS without private dental insurance, because the seniors most likely missing this benefit are simply those who never received a clear explanation that it exists. One important warning: scammers are calling Canadian seniors claiming to be from the Canadian Dental Care Plan or Health Canada, asking for banking information or a registration fee to activate coverage. This is a scam. The Canadian Dental Care Plan is completely free to enroll in and will never call you unsolicited asking for payment or banking details. The CRA will never demand immediate payment by phone or ask for gift cards. Hang up immediately and report it to the Canadian Anti-Fraud Centre at 1-888-495-8501. Did you know about the Canadian Dental Care Plan before watching this video today? And if you receive GIS alongside your CPP and OAS, have you already applied and been approved? Or are you finding out right now for the first time that you have likely qualified for full free dental coverage this entire time while paying out of pocket for procedures that should have cost you nothing? Drop your province in the comments, because I want to understand how many Canadian seniors watching are already enrolled and how many are finding out about it here today. After paying dental bills, a free government program should have been covering all along. What we covered today is confirmed, and the Canadian Dental Care Plan is available right now to eligible seniors across Canada in 2026. More benefit updates are scheduled before the end of this year, and Service Canada will not send you a personal letter explaining every program you qualify for based on your CPP, OAS, and GIS status. Subscribe now so that information reaches you here before another bill arrives that you should not have to pay. You spent your entire working life contributing to this country. You earned every benefit available to you in retirement. Make sure you are claiming every single one of them. I am Canada Seniors Update, and I will see you in the next one. Take care of yourself.